I'm Major Francis Rugesera. I'm a legal officer for Engineering Brigade, and I double as the coordinator of MDA projects, ministries, departments, and agencies that we work around the country. Right now, we are in Rwoburunga Health Centre. The commissioning is today by the Right Honourable Deputy Speaker of Parliament, Honourable Tayebwa, and the Governor Bank of Uganda. Why the Bank of Uganda? The Governor Bank of Uganda, because it was donated by them through Ministry of Health. Rwoburunga Health Centre started after the Memorandum of Understanding between Moldova and the Ministry of Health, which was signed on 17th May 2023. But the actual commencement was on 5th of July 2023. So some 2 months there elapsed in the organization. So the commencement was on 17th July. The scope is a maternity ward, specialized maternity ward, medical waste pit, external works, OPD. Those were the initial scope of the work. However, later we are added on some work of putting up a kitchen and a laundry, which we have done and finished successfully. This area of Mitooma, we've got so many other projects as Engineers Brigade that we are carrying out. For example, there are works at the Bitereko Health Centre 3. We have an upgrade of Bitereko Health Centre 3, which is in Rutoche, a few meters from here. We have Rwoburunga Seed School, so within also in Mitooma district. We have Bitereko Skilling Center, which is also in Mitooma. Then there is upgrade of Chijende Health Centre 2 to Health Centre 3. We have also Chijende Seed School, which is around this place. We have over 7 projects in this area, which is a really good blessing. I think we owe this to the Deputy Speaker of Parliament, because I can see most of the districts have less projects, but this one is a good one. To find that all these projects are in your districts and they are going on very well. Most of them, like 3 of them who have finished, were on completion. This one we have completed it, Rwoburunga Health Centre 3, and they are commissioning it today. And the rest, within 3 months, they will be finished.
My name is Akampura Joseph. I'm the facility in charge of Rwoburunga Health Centre 3. This new structure that was offered to us by Bank of Uganda, it is a maternity structure, maternity ward. So it serves the mothers who are pregnant and those who are giving birth. Our catchment area covers Rwoburunga sub-county plus Chianga sub-county, because we are the only health center 3 in the 2 sub-counties. In a year, we deliver around 500 mothers, and those that we offer antenatal services are about 3,000. Because of some facilities that were lacking before, more mothers were being referred to other health facilities. But with this new structure, which has some of the items and some of the facilities that we didn't have in the old structure, we are going to deliver more mothers and we are going to offer more services. Because, for example, we have oxygen concentrators that have been offered to us, we have incubators that have been offered to us, we have more beds which are more classy or more standard that have been offered to us, and we hope that even more health workers and more specialized health workers will be brought here. So basically we are looking at a future with better services.
UPDF Engineers Brigade, or the UPDF as a whole, first of all, by the Constitution of Uganda, we are mandated to work hand in hand with the wananchi for development of the country. So these projects, once we have finished them, the people who are around these areas, the sick ones, they go to these hospitals, they can have energy to go and do other developmental things, to do other works. Not only that, where we work from, we have a policy that 40% of the labor are supposed to come from the neighboring areas. So we provide labor to the locals around. The materials, we pick materials which are available and of quality from that area. So the locals around Mitooma have also gained one way or the other. Labor, materials, people, the food, our soldiers, they buy food around. That is one way that these projects we have also realized development of that in the community, that community.
Ganje nshemirwe Venesia ndaruga umuruka gwanduruma egomborera nibwo burunga ndasima ho buzima brangu batweretera maternity abakazi barabonabona baratemba barabaza kubatwara zishaka ziyanchwanga abamwe bafera mu muhanda ko kada simo ranga kuranga twe twabona maternity umujyo gumwanya gwitu gwegomborera yagwo burunga bebare munonga mukama abahumurije
bashemerwa munonga none ndwo mu village ya Kashambya mu kagwarwa rwa Kirabwa muri Rwoburunga sub county konke kinareba kandi cyakorwe iki ahabwo yabwa government yitu ya movement kandi kutsindikira Bank of Uganda kutombekera maternity nonko mushija ino kunashemerwa kandi kunashemerwa kusingaho ahabwo kuba mukazi kubere nayo kubwire ko kuzara njiro guhinza mitima njiro kwerarikirira ndandika kubara center yo kuzanta zine za transport konka mwe nukureba ngo hatu atungirwa rerungi eririmu nangwana nebikubasa korura abana bazarwa batakire harimo oxygen yo mwana wakubasa kugira ngo ise muke nabura cyankora je mununga abo mwabana babireni bafero mu rugendo mubaza kubarondera oxygen bafa batakakira oxygen zishaka za KU nkahandi konka kushanga ngo hato mwanya gwito mu Rwoburunga twatunga ebyo byone bikubasa kuyamba abana bito bani bazarwa cyatushemeza mununga ahangare Yoweri Museveni ahangare Thomas Tayebwa kandi ayebare mununga Bank of Uganda.
In a rainy season like this one, getting materials, of course they come far from Nyihanga, far areas from here. Our trucks get stuck on the way. Even today there are some that are stuck, but we soldier on. This is among the projects that we have around. We have around 8 projects in the Mitooma district. Provide labor to the locals around. The materials, we pick pick materials which are available and of quality from that area. So the locals around Mitooma have also gained one way or the other. Labor, materials, people, the food, our soldiers, they buy food around. That is one way that these projects have also realized development of that in the community, that community.
We have been given a very good suction machine to the electrical. All these are so right on the road, this is the round area. These are the toilets. The other side behind is the placenta pit. Yeah. And the tank. You can give us a water pump the water up there. Yeah. Moved from Bara up to Rwoburunga, and I've not seen anywhere they have put such a structure. Then we said it is our leader. So we give you all the honor. Thank you for choosing us for this opportunity. So Rwoburunga Health Centre 3 serves two sub-counties, that is Rwoburunga sub-county and Chianga sub-county. It is the only health centre 3 around. In a year we serve around 500 mothers, those who are delivering, and those who are coming for antenatal, they are always around 2,500. Of course, the numbers keep changing, but basically around 2,500. Our total population is 17,000 for both Rwoburunga and Chianga. So with those numbers, and by the fact that we are in a Rift Valley that is hard to reach, we believe the choice you did was the best. Choose Rwoburunga Health Centre 3. Yes, thank you so much for that. Rwoburunga Health Centre 3 has been having many challenges, and one of them has now been solved. So we have gotten a very beautiful maternity building. Those who have not gone there to tour around, we have the equipment, and actually some of the equipment that we have, there are nowhere else in Mitooma district. For example, the incubator. So I implore all the mothers who have been going to other health facilities to come and we deliver it from here, because we have what to use in plenty. Right Honorable Speaker, the Baganda say that Sima Bongerwa. We still have many challenges around. The infrastructure is not yet enough. Our OPD building is very old and almost collapsing. I thank you for that, because you made a promise to give us another one. I thank you so much for that. The staffing levels are still low. The few staffs who are there, they even don't have the staff quarters where they could sleep. And as we were coming, the road is really still wanting. So we are requesting you to keep lobbying for us.
Remember, I'm the one who brought sound. I insisted on engineering brigade. Rather, I'm the one who insisted. Say engineering brigade is already mobilized here. I know my people won't be started. As for kidogo, so let's give engineering brigade. And I want to thank you very fantastic. I want to thank you so much. I have seen a few small things. I know you will clear them out. Please hand over a very perfect. My sweetheart knows. I can see she's trying to hide from me. And I hope today you're doing well. Very good. Thank you.
First of all, we are appreciating, we are so much grateful having been chosen as the facility to get such an offer. We still have many challenges that we need to be addressed. For example, they have given us maternity, but even our other structures are old. Some of them are almost collapsing, like the OPD. The staffing levels are still low. So we would love the Minister of Health to offer us more structures. Even the staff quarters or accommodation is still lacking. We don't have enough accommodation. The transport to this place being in the Rift Valley is so hard, and sometimes mothers fail to go to the sites where we refer them because of transport. So we also beg for an ambulance and any other service that will be offered to us is highly welcome. This being a Rift Valley, I think it should be prioritized. Being a very hard to reach area, it should be prioritized.
On the impact of this project, I have vividly seen, for example, today in the commissioning, that the area MP has called ladies who are pregnant or 7 months and above, but I was overwhelmed that almost 20% of the population around were pregnant. Meaning, these people, the maternity ward is going to be of help. It has been fitted with some specialized machines, incubators for kids. The woman MP talked of people used to put kids in omweza, something, husks that come from millet, for a child who has just been born, to incubate from there. But now the specialized maternity ward is fitted with better machines. So I'm sure and confident that this project is going to be of help to this community. With the Engineering Brigade, whenever this project, there is what we call a project management team. This project management team, it includes district engineers, district locals, RDCs, such that whenever we are working on a project, the locals, area locals are involved. They are involved because whatever we do, even if it is bringing materials first, secondly, materials are tested, they are taken to the lab, the ones we use, and the results come out. So we are sure that quality control is done through materials being tested and the locals supervising the area, the project. Plus we have a mechanism in our own brigade that normally comes around. It's called a construction committee that comes around and checks the works that are done in the field.
Amazina ganje ni banyitacho Simire Silvia, nindugo mu village ya Rusoroza, egomborora ni Rwoburunga. Twashemererwa munonga itwe nk'abakyara ba Rwoburunga abwo kutereza igwaro. Twashemererwa munonga mazima tugenda tuza kuzara, tuza kubona motoka yo kututwara, okiza kuhika umuhanda oshanga umwana yafire ninga shina n'abakazi oshanga ni bafero mu mihanda. Konka mazima twashemererwa MP witu Tomu tayebwa Tomosi webare na gurupu yawe mwebare kutuhereza obuhereza itwe nk'abakyara.
Engineering Brigade started by the directive of His Excellency the President on 1st July 2021, but since that time up to now we have achieved a lot. We've built Nambole Stadium, renovated, but it was renovating and upgrading, so some of the things we had to construct them. Nambole Stadium, Entebbe International Airport, have done several works. We are still there. We are also improving on it. DCI, Directorate of Citizenship in Gulu, people of Gulu are no longer coming to Kampala to look for passports. They will be receiving them in Gulu. We are handing it over next week. Over 360 projects have been completed and others are ongoing in the whole country. These projects, once we have finished them, the people who are around these areas, the sick ones, they go to these hospitals, they can have energy to go and do other developmental things, to do other works. Not only that, where we work from, we have a policy that 40% of the labor are supposed to come from the neighboring areas. So we provide labor to the locals around. The materials, we pick materials which are available and of quality from that area. So the locals around Mitooma have also gained one way or the other. Labor, materials, people, the food, our soldiers, they buy food around. That is one way that these projects we have also realized development of that in the community. Challenges that are faced by a private contractor, I believe they are the same challenges that we are facing, because we buy the same materials from the same area, and sometimes we face challenges of weather. Once the area, the rain has been in an area and the roads are impassable, it becomes a bit hard, a challenge for us to take the materials like Rwoburunga areas. We take almost 4 to 5 days to reach such areas. At the moment, the clients that we have are the best. They believe in us, we believe in them, the discipline of our forces, because I move along the whole country. I talk to the DSOs, I talk to the cow, I talk to security organizations. So far, our engineers who have not had any indiscipline or safety issues. I thank the Commander-in-Chief for the opportunity he gave us, and we are working hard to make sure we achieve. You supporting us, and we shall continue building Uganda for God and my country.